Hi there, Chartreuse. My name's Ashley. I'm a student physical therapist at Owens Community College, and today I'm going to be doing some interventions with you based off of what I read from what the physical therapist found in your initial evaluation. I have some notes over here, so if you see me peering off, that's what that's for. So the first thing I want to address with you is your cervical flexion. So basically, this is just the motion of moving down and coming back up. I want to strengthen this range of motion with you because I found in your initial evaluation you had some strength deficits in that. So I want to help to strengthen that area. There's a couple of reasons why I wanted to do that. So the first reason why I chose to do that was to obviously increase your strength. I know that you're an elementary school teacher, so you are probably more than likely looking down quite a bit, making course content and grading papers and reading and all that fun stuff, typing. So I want to strengthen this area so that you can do these activities, so that you're able to do these and you can do these with comfort. If it was weak, obviously it would create a little bit of pain. So the second reason why I actually chose to do this exercise with you is to help maintain that stability in your neck to prevent any further injuries. So if you were to be looking down for a long period of time, not knowing like you should be moving your neck quite a bit, or you don't realize, I'm here to help make you aware of that and to help strengthen that area so that it can support those structures, it can support your neck as you are doing that motion to prevent any future injury or any flare-up of your current conditions. So the exercise I'm going to be performing with you is actually called cervical flexion with a TheraBand. So like I said, cervical flexion is just that down motion. And what I would be doing would be I would put a TheraBand right around the front of your forehead and I would hold it back here. So I'd be standing behind you, holding the ends of that TheraBand. If that TheraBand gets to be uncomfortable, if you don't like the feeling of that, we can put a towel in between just to make it more comfortable for you. So for this exercise, I'll have you seated, and I will put that TheraBand around your forehead. So as you're sitting down, I want you to maintain good posture. I want you to keep your feet flat on the floor. I want you to keep your back straight, your shoulders back, and keep them down and back as you're doing this. So you're keeping that good posture, maintaining that spine, just so that you can perform this exercise within and work the muscles that I want you to work. So after the band's around you, I want you to bring your chin to your chest, and I don't want you to do the complete motion. So I want you to take 3 fingers and put it in between, like kind of where your chest would meet your chin. So as you're coming down, you stop as you feel where your fingers are hitting your chin and coming back up. And eventually you'll get comfortable with that range, and then we can get rid of the fingers and kind of do that just with your normal range. So yes, so you'll be having the fingers here, shoulders are back, your feet are flat, your back is kind of like you can keep your back on this back of the chair if you need to keep your posture from getting messed up as you're doing this. And you will, let me move and make this a little bit, hopefully I don't fall as I'm doing this. And you will bring that chin to your chest. So it will look like this. You'd have the TheraBand around you, I'd be standing behind you. Your 3 fingers would be right here. And then you're bringing your chin to your chest and coming back up. Okay. So, I would want you to do this exercise in 3 sets of 5. In between sets, I'd want you to take a break, take about a minute break in between. So one thing that you would do that would be like what we consider bad form would be to be slouching while you're doing this. So a lot of the time, some people don't really remember to put that. I don't know why I'm moving my chair around everywhere, but you know what? It's for the greater good. Okay, so a lot of the time people don't really think to use your other supporting structures. So as you are doing that exercise, you're kind of zoned in on doing that. So sometimes people will round their shoulders forward, or to get more range of motion, they'll bring them forward so that it looks like they're using their neck more, but they're really just rounding their shoulders. So I really want you to keep those shoulders back, keep them over your hips, and really just move at the neck. Don't use any other supporting structures. We're just increasing the strength in your neck. Okay. So one thing that you can do while you're doing this to kind of know that you're really activating the muscles that I want you to activate is you could keep one hand here. So you'll feel it in the back of your neck as you're coming down because you are extending the neck. So you are, or not extending the neck, you are stretching what we call extensors of the neck. But you should really be feeling the contraction in what we call the sternocleidomastoid. So you can feel this kind of pop out as you are moving forward. So you keep your hand here, you feel it kind of popping out. You can kind of see it on me. My sternocleidomastoid is very prominent as you're coming forward. So you can definitely feel that there. And something that I would do for you, just to let you know if in case you feel like, in case you were doing some compensations, so doing anything that would not be appropriate for the exercise. So I know I said earlier that a lot of the time people will round their shoulders. So for you, I would kind of keep my hand behind your back, right? If you were to feel my hand leave your back, so if my hand's on you, before you're doing that range of motion, right? So my hand's back here. And then you start to do that rounding motion we were talking about, and my hand leaves your back. That's how you know that you are not maintaining those shoulders back, that you are rounding the shoulders, leaning forward, kind of compensating, and that's totally normal, it's totally fine. But I'm here to help correct that. So I tell you, chartreuse, my hand just left your back, try to bring your shoulders back and really just move at the neck. So one reason to stop this exercise would be if you were to feel, I know you have those radicular symptoms, so basically what that means is the pain is kind of traveling down that arm, right? And if a reason to stop would be if that pain increases, and I know it goes to your fingers, but if it were to get like more intense, or if it would start to spread to other areas, so like I know you have it in your back or in your neck, but if it were to like maybe start going down the back or maybe the front or anything like that, I would want you to let me know. Alrighty, so the next exercise I want to do with you is called, I'm going to just pause for one moment, hold on. Hi again. Okay, so the next exercise that I want to do with you addresses your cervical extension. So I'm actually going to be doing a stretching exercise with you. So I noticed during your evaluation findings that you had some limited range of motion, so you kind of had some problems looking up. So this is extension. So the stretch that I want to do with you is called cervical flexion with overpressure. So basically what this means, and I'll show you, is you will, now I don't want you to go through this whole range of motion, so I'll go more in detail with this. So I want you to put your hands behind your head, right? Now, same deal with this one. I want you to maintain that good posture, right? I want you to keep your feet flat on the floor, keep your back in line, and I don't want you to hike your shoulders up as you're doing this, because this just looks uncomfortable doing this, doesn't it? So keep them down, right? Yeah, it's more comfortable that way. Okay. So, hands are behind the head, and you're going to bring that chin to your chest. Now, I don't want you to go through that full range of motion, remember. So, you can even just do this with one hand, because you did just have that injury 2 weeks ago. So, you should be a little more cautious. Way on the caution side. So, you can have that hand there, but I have a feeling after a couple of times, you'll remember to do that range of motion, right? So don't go bringing the chin all the way to the chest. So we're here, right? Bringing that head down, using the hands up behind your head to really pull, like gently push, and really get the flexion here to stretch those extensors. So as you're coming down, you kind of use some resistance up here with your hands, and you're kind of pushing down, and you'll feel a good stretch right in the back here. Now I want you to hold this, and then we'll come back up, and then relax. Okay, So I wanted to do this for a couple of different reasons for you. So the first reason I wanted to do this stretch with you is to help you to look up at that smart board. So I know that you are, if you do have a smart board, most classrooms nowadays have smart boards, or dry erase boards, or not the point. When you are looking up at that smart board, I know you're doing that for a pretty long period of time. And I want to make this more comfortable for you. And I want you to be able to look up as high as you can, as high as you're able to as a human. I want you to get back to your peak health, to how you were before. That's the whole point of therapy. And the second reason I wanted to do this with you is to eventually start strengthening. So we can't really do any strengthening right now if you can't look up all the way. You can't do that full range of motion. So what would be the point of strengthening in that range of motion if you can't do it all the way? So eventually we want to start doing that to support the structures in your spine to prevent you from further injury, and to help protect and to help from your protrusion from getting worse too. This is why I'd want to do this with you. Okay. So I'd want you to do that stretch 4 times, hold for like 15 seconds, and then take that break for 60 seconds in between. So you're keeping your feet flat, shoulders are down and back, right? And you're keeping that spine in line like a string is going through you. Okay. So, one thing that I do not want you to do is to round that lower back. So as you're doing this, right? Move my chair again. Hopefully you can see me. I think you can. Let's bring this down a little bit more. Okay. All right. So we're sitting in the chair. Okay. You got your hands behind your head. We're doing this over pressure, not going through that full range. Just to about halfway. Sometimes people forget about their low back when they start to round it, as you can see right here. Really keep those shoulders over your hips as you're doing this so that you are strengthening or stretching these muscles back here. If you're doing this, all of the muscle activity is coming from back here. Nothing's happening up here, you're just coming forward. So we really want to get that full extension. Really get those muscles to stretch. Okay. So something that you can do during this stretch to make sure that you're stretching the right area would be to put one hand on the back of your head as you're doing this. So you can really feel back here, and especially me, I have a bad neck, so unfortunately, but we all have our problems. So you would feel back here, bringing that chin forward, and you can really feel this start to come back out at you. So something that I would do for you to prevent you from doing any compensation, put my hand in front of your chest, right? So while you're doing that, I'd be standing in front of you, and I'd have my hand away from your chest. I wouldn't be quite touching you, or on your shoulder. I'd probably do your shoulder just to err on the side of caution. So right in front of your shoulder, I'm standing next to you. You're doing this overpressure, and you start to lean forward. If you start to lean forward, you'll start to feel my hand make contact with your shoulder. This would be a time to think, if I'm leaning forward, I'm meeting her hand's maintained in front of me. So, if I feel her hand, that means I'm leaning forward. I need to bring it back. Maintain that spine. Keep it straight. Yeah, so keeping that hand here. If you feel my hand making contact with you, it'd be kind of a cue for you to kind of lean back and really just focus on that neck extension. So one reason to stop this stretch would be if you were to get lightheaded. I know that sometimes doing this motion can get people lightheaded, especially if you're doing that resistance back here. You have your hands up. So if you start to get lightheaded, go ahead and stop, take a break for a little bit, and then listen to your body and see if you want to go forward or not. Probably err on the side of caution, and I would say not to do that, but again, you know your limits. All right, I'm gonna review your next exercise, and I will be right back. Hi there again. All right, so the next exercise that I want to do with you is called cervical lateral flexion with a TheraBand. So I chose to do this with you for a couple different reasons. First reason being that I know that you have to talk to your students and you have to talk to parents all day on maintaining eye contact with your peers. So I want to address the cervical lateral flexion, which is that motion again, so that you can help keep your head straight and to prevent any future injury or any compensation like that, and keep the body in line. That way you're not ending up like this and your head's kind of stuck sideways. We're helping to prevent that. The second reason why I chose to do this is to increase the stability of your neck, and to help prevent any flare-ups of your current condition. So strengthening this motion will help to support the sides of the neck. That way you're not kind of leaning on to one side, or maybe you're kind of doing this, and then all of a sudden your extensors, everything gets affected, right? So we want to strengthen every range of motion that we possibly can that is impaired, so that we can keep it in its normal range, in its normal posture, and keep good body mechanics. Okay, so for this exercise, I will show you here. Okay, so you'll be seated in this chair, and I will be standing off to the side over here. The TheraBand will be around your head again, and we can put that towel there in case you feel like that is uncomfortable for you. And then I'd be standing off to the side. I'd be holding the ends of the TheraBand here, and then you'll kind of feel some resistance as you're standing here. I want you to bring that ear to that shoulder, right? And come on back. So you'll feel the resistance of the TheraBand as you're doing that. Now, I don't want you to go through that full range of motion. I just kind of want you to come about halfway, because then this is not very functional. No one really does that. So we just kind of want to do this and come on back, and then relax. Okay, so we call them 3 points of alignment. So three things that I want you to kind of keep in mind as you're doing this. I want you to keep your feet flat on the floor. Back is against the chair, right? You're keeping that back straight. No curving, no slouching anywhere, here, shoulders, or anything like that. You're keeping the shoulders back over your hips, and then performing that lateral flexion against that TheraBand. And you'll do that on both sides. So I'll come off over here, hold the TheraBand here, and then you can do that way. If you were to do this by yourself, you can kind of hold the TheraBand up with one hand and do that same thing as well. Alrighty. So for that exercise, I would want you to do 3 sets of 5, just to kind of get you comfortable with that range of motion. So one thing that I don't want you to do while doing this exercise is to shrug your shoulders on whatever side that we're doing that in. So I know that sometimes people don't think about it. It's always the motions that we don't think about, but I make you aware of. So sometimes when patients are performing this exercise, they'll have their resistance here, right? And then they'll bring their head over here, but then they'll start to bring that shoulder up. And then they're like, look how far my head can move now. I feel like I'm great, right? No, bring that shoulder down. You got a little more range to go. So yes, we want to prevent that shoulder shrug. We want to keep those shoulders down and back over the shoulders. So something to prevent you from, or something to correct that would just bring that shoulder down. And really just move at the neck. You don't want to move anything else other than the neck. That's what we're working on. Okay, so something that you can do to make sure that you're really working those muscles that we want to work. So again, with the sternocleidomastoid, it also does lateral flexion. So as you're doing that, right, you will feel, and you can see mine just with the resistance of my hand. You feel back here, right under where your ear kind of is and your neck meets your head, it comes all the way over here. So you'll feel that, and you can see it in me as you're doing that, and that's a cue that you're doing the right, or you're activating the right muscle as we're doing this. So something that I would do for you to help you prevent you from doing any compensations, I would keep my hand above your shoulders. Stand over to the side holding the TheraBand, and I keep the other hand right above your shoulder, probably about here. whichever shoulder that you're doing it with, right? So as you're performing that, if your shoulder touches my hand, you're doing that shoulder shrug. So just remember to bring that shoulder down, bring it back, come over, relax, and really just move at that neck. So one reason I would want you to stop this exercise would be, again, that increased radicular symptoms. So if you feel that that pain is starting to go down that arm, or if you feel like it starts to flare you up, or if you start to get really fatigued in this motion. So if you feel like the resistance with the TheraBand is a little too much, whatever TheraBand that we choose to do, we can either go down a size or we can just try to work on that lateral flexion, just side to side. Maybe just doing with a hand so you can control where the pressure is, but there's things that we can do in case that does happen. Okay, let me review your next exercise. All right, and we're back. Okay, so this last thing that I want to address with you is called cervical rotation. So this is the movement of just looking your left and right, looking over your shoulder. Okay, so a couple of reasons why I wanted to address this with you is because I noticed during your evaluation finding you had kind of a severe lack of range of motion there. You're only able to do a little bit of this, and that could cause some problems, right? So the first reason why I chose to do this with you is to help reduce that pain in that range of motion. I'm sure you have that cervical, and I know you have that cervical pain, as I read in your evaluation. So I'm sure this is kind of painful looking over your shoulder, especially to a certain point, especially with your conditions that you have. So I really want to address this and help to reduce that pain and really get those tissues in your neck to kind of extend and let you move a little bit more. So the second reason I wanted to address this issue with you is because I know that you have to drive to work, and that could be hard if you can't look left and right, for your safety too, and for other people's. So this will help to move your neck to look for like oncoming cars, oncoming traffic, to be aware of other drivers, when you're making a lane change, if you're looking at your mirrors, all types of stuff while you're driving. So this will help to make you more safe as you're driving and to help you transport yourself to work and for the safety of others. Okay, so this stretch that I want to do with you is called cervical rotation with towel overpressure. So what this looks like, coming back, and as you can see, I have a prop with me now. So as we're doing this, we're keeping that good posture, right? Feet are flat on the floor. Back is straight, shoulders are over where the hips are. You're keeping everything in line as you're doing it. Strings coming down through, straight string. You're keeping that contact with that, okay. So, coming forward. You will put this towel around your neck. That can be any type of towel, it doesn't matter. Smaller towels work better because it's not as bulky. It doesn't cover your face up as much, but we deal with what we have. Okay, so feet are flat on the floor, shoulders are back, everything's straight. And what I want you to do is you're going to grab onto one side with your opposite hand that you're stretching in, right? So this hand is going to be holding onto this end of the towel. So you kind of have your hands in an X here. You're going to bring this towel up kind of over your face. It might be uncomfortable, but it helps. And you're going to direct that towel over and really look over. As you're doing that, you'll hold for a couple seconds. Keep those shoulders back. Back is straight, and you'll really feel it down here in your neck, right? And then you'll come back and rest. Okay. And then you'll do the same thing with the other side. So here's what that looks like, right? Hands are crossed. Bringing the towel up over the head. Keeping this taut and directing your head over, keeping that shoulder back. And really feeling that stretch down here as you're doing that. And come back. All right. Bonk. Okay. Looking at my notes. Okay. So one thing that I don't want you to do while you're doing this stretch is, I know sometimes people, like I said, they don't really pay attention to anything other than what they're working, right? So sometimes when people are doing that overpressure with that towel, right, they'll lean over a little bit. Kind of creates the perception that you're moving a little bit more because your perception changes, right? So it seems like that you're moving the neck a little bit more, but you're really just leaning at your trunk, at your back. You're activating those back muscles when we really want to focus on those neck muscles. So we really want to keep those shoulders back, keep the back quiet. Everything that should be activated should be in the neck, and you're moving that towel. Okay. So something that you could do to make sure that you're stretching the right location, like I said, you would put your hand here, and kind of how I was demonstrating as I was doing that towel overpressure, you could keep your hand here, and as you're coming over, you can really feel these muscles start to elongate, right? And you can kind of see right here, kind of like where your shoulder meets your neck, right? And as you're moving, you'll feel that really start to extend, and you can kind of see it on me because I have a tight neck, so. Okay, and then something that I would do for you, just in case you were to have some bad posture, something that I don't want you to do, just to work the structures that we are here to work with, I would place my hand kind of behind you, right? Or not behind you, beside you. Yes, beside you. Okay, so I'd keep my hand beside you, just away from that shoulder. And as you're doing that towel overpressure, if you start to feel my hand make contact with that shoulder, that's a cue for you to lean back and kind of sit down, relax those muscles, and then restart the stretch and really just move at that neck if you feel my hand tap you. So one reason for you to stop would be if you were to irritate that protruding disc. So I know that sometimes stretching and with your radicular symptoms, kind of traveling pain and that protruding disc could create some complications. So if you feel like that's starting to flare that up, or if you start to feel like maybe the towel is irritating it, let me know, and then that would be a reason for you to stop that stretch. I know I went over a lot of information with you today, Chartreuse. I just want you to kind of tell me what the main topics were that I talked to you about today. So what we're addressing and the things that we're doing to do that, and then basically just like a rough example of the exercises that I showed you today. Alrighty. Okay. And if you have any questions for me, just let me know, all right? It was nice to meet you today. If you have any further questions, you can just give me a call or you can email me. And then going forward, and I will show you in the next video your home exercise program. So these are things to kind of work on throughout the week on your own when you're not in therapy. And then we can address more there. All right, it was nice to see you today. It was nice to work with you, and you let me know if you need anything more. Thank you.